Pregnancy cravings. When you gotta have it. Pregnancy and food cravings go hand in hand. 3 experts offer suggestions for healthy cravings. Pickles and ice cream. Cheese whiz on steak. Brownie mix. Straight from the bowl. While these may not exactly seem like gourmet fare, if you're pregnant they can seem like heaven on a plate. The reason: pregnancy cravings, those seemingly unquenchable longings for oftentimes eclectic combinations of foods that you might never otherwise even dream of eating. But what's behind these mysterious food fantasies, and can they ever be harmful? Doctors say the answers depend a lot on what you are craving. No one really knows why pregnancy cravings occur, though there are theories that it represents some nutrient that the mother may be lacking, and the crave is the body's way of asking for what it needs, says Andre Rebarber, MD, Associate Director of the Division of Maternal Fetal Medicine at NYU Medical Center in New York. When that overwhelming desire for pickles or processed cheese hits, Rebarber says it could be the body asking for more sodium. That aching for a Big Mac and a plate of fries may be your need for more protein, sodium, or potassium. The burning in your belly for a double helping of chocolate double latte ice cream may be signaling a need for more calcium or fat. It's not that the body actually needs the specific food you are craving, but it may need something in that food. And your taste buds just interpret it as a craving for something specific, says Rebarber. What's more, many experts say our taste buds do actually play a role in how we interpret our body's needs. Studies show that the high hormone levels present during pregnancy can alter both a woman's sense of taste and smell. So certain foods and odors can not only be more enticing but in some cases more offensive, a problem that often plays out as a pregnancy food aversion. Food aversions are most often associated with early pregnancy, when they are likely to touch off a bout of morning sickness, with nausea and vomiting, says Rebarber. While some pregnancy cravings can certainly seem a bit odd, in most instances, they don't represent any real threat to mother or the baby. This, however, can change dramatically when the craving is for a non-food item. The condition, known as pickle, can lead to an overwhelming desire to consume any number of substances, some of which can be extremely harmful to both mother and baby. What do pregnancy cravings mean? Some nutritionists and healthcare providers believe that certain cravings are meaningful. For example, some experts think that craving large amounts of ice and non-food substances, such as laundry starch and dirt or clay, a condition called pickle, are linked to an iron or zinc deficiency, though there's not enough research to support a cause and effect relationship. San Francisco midwife and herbalist Cynthia Ballou says some food cravings may be worth paying attention to. For example, alternative medicine practitioners believe that a shortage of magnesium can trigger a craving for chocolate. Foods that contain magnesium include whole grains, beans, nuts, seeds, and green vegetables such as spinach. Ballou has also found that many of her patients need more essential fatty acids in their diet. When they start taking fish oil or flax oil, their food cravings disappear. Similarly, a craving for red meat seems like a transparent cry for protein. And the mom in our survey who said she consumed great quantities of peaches may have been responding to her body's need for beta-carotene. Judith Brown, author of What to Eat Before, During, and After Pregnancy, agrees that in some cases there might be a biological cause for cravings. She points to pregnant women who develop an aversion to certain foods or drinks that might be harmful, like diet soda, coffee, or alcohol. But Elizabeth Sommer, author of Nutrition for a Healthy Pregnancy, doesn't see much of a link between a pregnant woman's cravings and what her body needs. People think their cravings are significant, but studies show no link between cravings and nutritional requirements, she says. If people craved what the body needs, we would all eat more broccoli and less chocolate. And at this point the evidence, while hard to ignore, is anecdotal. There's no scientific explanation for food cravings. There's no data saying that what a woman craves is related to something her body or her baby needs, and there's no data to support that typical pregnancy food cravings are harmful, either, explains Brown. What to do about your cravings in the end? The experts we consulted agreed that you should pay attention to your pregnancy cravings, and indulge them in moderation. A healthful diet is one that meets your nutritional and your emotional needs as well as your preferences, says Sommer. She recommends that pregnant women humor their cravings rather than fight them. But don't let unhealthy cravings completely overpower your need for nutritious food. Check out these alternatives for less healthy cravings. Craving sweets is sometimes the result of a drop in blood sugar, so eating small, frequent meals may help you avoid eating too much sugar. Other ways to curb less healthy cravings: eat breakfast every day. Skipping breakfast can make cravings worse. Exercise, and make sure you have lots of emotional support. If you find yourself craving non-food items, such as starch, chalk, flour, dirt, or large amounts of ice, talk to your healthcare provider. Some studies estimate that more than a third of pregnant women have similar cravings. Because some non-food cravings can affect your health, it's especially important to mention them to your provider. Here are some frequently asked questions on pregnancy cravings. 1. How early in pregnancy do you get cravings? If you do start having cravings, it'll probably be in your first trimester. It could be as early as 5 weeks into pregnancy. They'll get stronger in your second trimester, and then eventually stop in your third trimester. Cravings come in all shapes and sizes. Some women crave fatty foods like chips. 2. What is the most common pregnancy craving? Common pregnancy cravings include chocolate, lemons, spicy food, ice cream, red meat, cheese, pickles, peanut butter. 3. Is it bad to ignore pregnancy cravings? It's true that many pregnant women have specific or unusual food cravings, but it's perfectly normal not to have any cravings at all. A lack of cravings doesn't mean there's anything wrong. In fact, if you're not craving fatty or sugary foods, you're more likely to make healthy food choices. 4. Can you get cravings at 2 weeks pregnant? At this early stage, you are more likely to experience a change in your appetite than cravings for particular foods. You may notice a metallic taste in your mouth and be extra sensitive to the smells of food or cooking. The pregnancy hormone, progesterone, may make you feel hungrier. 5. Is it okay to give in to pregnancy cravings? It is okay to give in to the occasional food craving, as long as you continue to eat a good variety of healthy foods. If you are craving a lot of unhealthy foods, such as sweets or chocolate, try not to overindulge. Too much sugar can cause excessive weight gain and dental problems. 6. Do pregnancy cravings affect the baby? Given that food cravings may be associated with certain nutritional deficiencies, which may impact fetal development, it is possible that cravings and acquired nutrition during pregnancy may impact later development, i.e., child behavioral issues. 7. Does what you eat during pregnancy affect what your baby likes? In fact, your baby's sense of taste starts developing early in pregnancy. He tastes a version of what you taste, and research has shown that the foods you consume during this time may help shape what your baby will enjoy eating, even years later. 8. How does what you eat get to your baby? The nutrients from that snack are absorbed into her bloodstream. The bloodstream delivers the nutrients to the baby through the placenta and the amniotic fluid. From there, the baby's body puts the nutrients to use to help him grow throughout your healthy pregnancy. 9. Why does baby move after I eat? Many moms notice extra movement after they've eaten. The reason: the accompanying rise in blood sugar gives baby more energy to somersault. Give that baby a score of 10. Sometimes, babies kick more frequently when the TV is on or music is playing. 10. Kindly subscribe to this channel for more daily health tips. Thank you.